Dr. Malathi, what are the steps you take to maintain quality standards at Aster DM Healthcare?
Very, very important, because maintaining standards, as you use the word maintaining, is, I think, the key word. I would also probably think that what you're talking about is sustainability of the standards. One thing is to get the standards, achieve the standards, but more important, and I would say is more difficult, is sustaining it. Because once you have attained the standards, you really do not want it to come down. Now, the most important aspect is, how do I know that it has come down? Which means I bring to a very important point, and that is, do I measure my standards myself? One is, we talked a lot about accreditation, which is fine, which is an external body, but I need to make sure that I have systems in place and I keep measuring what I do. So the first thing that I always say is, do I measure my outcomes? Which means, what is the quality of care? Anything which is not objectively measured, it is very difficult to monitor. So I always believe that you ought to measure. What you measure, you can monitor, and what you monitor, you can improve. So if you don't measure something, I would always be under the fool's paradise that everything is very fine. So we keep putting in systems of measuring the outcome of every service that you provide. Now, this could be in terms of patient satisfaction, that is extremely important for us, but we also measure outcomes in terms of our surgical care. What are the complications? Did this patient come back to the hospital within a specific period of time? Was there any infections that we had? Was there a fall? So on and so forth. This is what we call it as our quality dashboard. The quality dashboard depicts exactly what is happening in the hospital in terms of our systems and our processes. So it is important for me to know, I am happy with what is happening today, but what is important for me is to see what is my trend. Am I maintaining it? Have I done extremely well in the month of March, in April, and then I suddenly find that I have come down? So the trend analysis is what keeps us going and makes us believe that there is sustainability. Yes, there could be a drop, because after all, we are all human beings, we are trying to drive quality. So what we tell them is, okay, there has been a drop, fine. How do we make sure and we learn from what has happened? So sustainability is all about measuring my outcomes and putting systems into place. The second very important aspect of it is, we also constantly create awareness. So everybody who joins into the organization from the day one, it actually moves into and understands a culture. So quality, I also use another term, other than saying it is a journey and it is not a destination. I always say it is a movement. It is a movement, it is very dynamic and varies depending upon the situation. So we learn at every point in time. We create programs of induction, awareness, and each one learns from the other person, which is what sustains it all the time. Having said that, quality will be sustainable if and only if it is driven from the top, which means the leadership should believe in quality. This is something which cannot be driven from bottom. And therefore, I would believe that in Aster DM and all the institutions which believe in quality, drive it from the top. It is from your chairman, from the board, who believe that this is important, and they get involved every month to know what is the quality outcome. You would find that probably my chairman would know exactly what is the infection or what is the fall rate in every hospital, because that's a dashboard that comes to him. So driving it from the top and making sure it percolates, getting the involvement of everybody in the particular hospital or in the medical center, so that everybody believes I am responsible for quality. So I always say, quality person, the chief of quality, I am just a facilitator. I'm just going to help you in achieving things, but the quality is a responsibility of every individual, chairman down on up to my housekeeping staff. Because if he is not going to implement quality in cleaning the hospital, I still cannot achieve excellence. So that is what is sustainability, and you can sustain if everybody contributes to the movement. It also sustains if you develop centers of excellence. You have to make every department totally to grow and to achieve centers of excellence. So I think one of the ways we have achieved this at the Aster DM is to create these centers of excellence, and every one of them, whether we call it as a cardiac science is a center of excellence, we have the neuroscience and so on, every department is a center of excellence. They become accountable totally for their processes and their outcome. That is how it sustains across the group. So that's the reason why we believe that it should be something which moves across from department and from individual to individual, and finally reaches that one and only one person for whom we survive. And we today are probably sitting here talking about is because of only one individual, and that is the patient who is writhing in pain in the beds of the hospital. If he didn't exist, we wouldn't exist. So we owe it to that person and make sure that it is sustainable.
And what about at Dr. Sulaiman and Habib Hospital?
She has beautifully phrased the journey of how do we measure and sustain or find chances of improvement. We see what are the processes, we measure are we doing right, we have some benchmarks, we have targets. So benchmarks, when we say, we take care in Sulaiman and Habib 2 to 3 benchmarks in terms of seeing are we doing right. One would be international benchmark, one would be a national benchmark, and then we also see for our hospitals surrounding what do they have. Based on that, we set a target. Are we meeting those targets? Now, she rightly mentioned that if we are not, there's a cause and worry why we are not having it measured and why we are not meeting it. Now, there's other aspect of it as well. Suppose we say key performance indicator. Suppose we say that X key performance indicator we are having 100% for consecutive months, which means we achieved, we sustained. Right. Now, this means that is there something else we need to look now? So we call all the department heads for all the end users, say, look, this you have achieved and sustained. Let's look at some problem you want to have guidance upon. So they come out with this thing, okay, we are having this problem in our department. Let's put it as KPI. Let's work on it. Because at any moment, when we say one KPI is complete, we switch on to the other. And that's how we widen our horizon of taking care of what we want to measure. Yeah. We also, in my, as a quality head, I would take my team for brainstorming sessions very often. Yeah. Now what happens? Brainstorming would say, okay, 10 people together, they speak about everything. It's a different brains for that storming session. For example, if I have a clinical issue, I would take a non-clinical person to give me an idea. How it would benefit me? Clinical is focusing on that problem, tunnel. Right. Now the non-clinical would look from outside, and he might give me some idea which would be more important for a process to be changed. So we involve, again, staff involvement. That gives us a better stream to work upon. So that's how we work. And again, the teamwork, it carries a great importance. So when I always say, when I, me and myself goes, we, us and ourselves comes, that's where the team starts. And that's how we do it.
Lovely. Dr. Vineet, what are the new quality laws or standards introduced by the government of UAE, and how has it helped setting a new standard at Dr. Sulaiman Al Habib Hospital?
2031, 2071. 2021 is well-being, 2031 is strategies for well-being, and 2017 is a Sentinel event where they want to have 90 projects on psychological and digital health. Now, this gives us an insight of how we are looking at a long distance. So they have certain laws, they have certain objectives which they share with us. And additionally, they are adding on to the level, as she said in the past, raise the bar. The UAE government is raising the bar. It's not that they are making it difficult, it's making it more safer and more process oriented. When they raise a bar and put a standard, it means there is a value add. When we say value add, it does not mean a value add in terms of financials aspect, in terms of safety of a patient, in terms of a process. So, for example, there is a constant revision from the UAE laws. For example, DHA, they have made certain different regulations for daycare center, for example. Right. They have made little higher bar. Recently, we had a supervision or a survey from DHA. Right. So we came to know this is an improvement from the past. Right. And I really appreciate and invite, because that's how we get in level stepwise. we should not be jumping, we should go stepwise, and that's what the UAE government is doing for all the healthcare sector, inviting all the specialists and medical tourism to give the best it can so that the local population as well as the expats are treated here with all the best expertise. That's why they are changing and adding the things to make it happen. The other thing also is that they're inviting people globally. What is the advantage? The laws are made to invite global physicians. Now their expert, their experience, their exposure, and the best clinical practice is brought in the country to give the best to the population. And that's what they aim for. Whenever they give a set of revised regulations, we'll look forward to it. We'll look forward what is better now. So that has made a paradigm shift in our care to understand what is it that we can do better. And the organization looks at me, and in her case would look at her. What can you offer to the organization, to the patient, to do better? And that's how it has helped.
And what about you, Doctor?
Actually, I would also take it from him. The cue is that the most important aspect of the Dubai health authorities is that they actually look at even from a grassroots level. Even taking up simple things like we might say is adhering to your antibiotic policy. It has actually strengthened us and made it much easier, which where in many times is very difficult to implement sometimes. But because we know that this is a regulatory requirement that comes from the Dubai Health Authority, it has streamlined our processes. And when I say that it is all about, say, the antibiotic adherence, it ensures that my patients get the right antibiotic for the right type of ailment and prevents the development of what we call in technical terms MDRO, which is multi-drug resistant organisms. Now that's extremely important from patient care. This comes directly from them, and they say please make sure that you have a proper antibiotic policy and adhere to it. So it is not only at the higher levels of clinical excellence, it's even at the grassroots level that it is ensured, making sure your regulatory norms. There are very, very surprise visits which are very good. So we are always well aligned and tuned to say that let's make sure that we adhere to that, whether it is your narcotic policy, which could be totally abused, but you have some absolute systems put into place and they come and check. And therefore, it makes sure that these health regulatory authorities are making sure and helping you, and I put it in simple terms, they strengthen your hands of the hospital to implement quality systems. That's what is the role of actually the UAE government.
Okay. Anything to add to what
No, I totally agree with her because whatever value add is there, it is not for one organization or one, it is for the country. And when the country adopts those things, it progresses to a different level. And that's what the aim of our leaders of UAE.
Dr. Malathi, the criteria or practices of increasing quality has become of utmost importance. How has technology played its part in helping you achieve this?
Technology, yes, again, the key to success. Because what is important at the end of the day is what we deliver to our patients. There are a lot of things which have been going on from time immemorial, and that is basically on a lot of things that we do as individuals. But a time has come because of the large number of patients and the advancement that has happened that we ought to provide the best to the patient. It could start with simple things as having, let us say, an electronic medical records. Now this is so very important because it captures all the data that you want, so that whenever you have the patient coming back to you, you don't have to start from again as to what had happened because there is a continuity. Secondly, the patient might travel from your unit to some another unit of mine, and I still have the complete continuum because he has the same data available in the other unit. So getting into electronic system. For me, a very, very important factor of technology is actually my medication management. Now, the errors that can happen by writing a prescription is totally circumvented when I have a system which I can indent my medicines. And there is a pop-up in it which says that, tells the doctor that it appears that you have given similar medications. You may have to bring down your dose. Now that gets integrated inside. I have an entire system in my electronic records that the moment I put my drug, it tells me that you have given this drug already. Please look at your dosage. Are you complementing? Are you acting one against the other? what is your food drug interaction, everything pops up automatically. So you don't have to rely all the time on my memory, because I can make a mistake with a large. So that's something which happens phenomenally. The third is simple things as apps being available now. Patients can book their appointments. They don't have to sit and call the call system. I go into the app. We have chat boxes where you can start talking, saying, this is a person I want to talk to, I want to meet, do I have an appointment, is the slot available? It just fixes straight in, and you walk into the hospital, it is done. You enter in, you have kiosks which are there, which you key in, and you put in your number, it will give you your lab reports. You just pick up your lab reports and walk. You don't have to wait that it used to be earlier at your laboratory, waiting for it, getting into lines to get your system. No, you go in, queue, put in yours, and you get your laboratory. It's also available, all the reports are available to all the doctors in most of the hospitals now, including ours, is that you can view and I can treat the patients. I don't have to wait, call, get the report in a hard copy, what happened to the hemoglobin, what happened to the blood count. It's just right there with the patient. How does it help? Quickness. My decision-making process, at the end of it, a patient would like care to be as early as he can get it. So it automatically takes care of those aspects of it. And of course, as we go on, there are large number of these which have come into, which has been used very well, and end of it to deliver care. And most important of all, now we are proceeding more and more into what we call as predictive analysis. We have gone into artificial intelligence and looking at various innovations, and all of it to see what difference will it make to the care of the patient and making it affordable. It's not the question of only getting huge technology and investing it, but getting a technology which could help you in the decision making and accuracy of care. So I think that is what we aim at Aster DM. Very, very clearly brainstorming with the best of the minds in that field, finding out what is the next step that you should take, which is going to make care delivery far more easier. So that's how the technology has been in it. At every stage we have this, gone on to teleradiology. So we have teleconsults which are there, follow-up patients can call up. At the same time, we have always made sure we ought to abide by the regulatory norms of that country. So that is always borne in mind, and then we have put into technology into place.
What about at Dr. Sulaiman Al Habib Hospital?
Well, that's very interesting also to say. We are Sulaiman Al Habib Group is corporate is from Riyadh, Saudi Arabia. Dr. Sulaiman Al Habib himself is a pediatrician, and he is a motivator for all. We have about 7 hospitals in Saudi and 1 in here. The software and IT solutions have been developed by ourselves, by a company which goes by the name of Vida. There is a high level of IT. It's HL7 is the highest. We have achieved that level as well. Recently, we entered into Guinness Book of World Records for highest telemedicine systems we have. We have 769 patient ICU beds integrated in tele-ICU. We recently got a Guinness Book of World Records certification. To talk of that, as well as what she says, integration and taking all the data in front of you, the applications which apply to the system is reducing medication errors. And then a great example is that we have an application. For example, the physician concerned is at home and there is some medication to be advised. So a medication advised by the doctor is conveyed to the consultant. In his mobile, he has an application. He writes the medication and it goes directly to the hospital from his home to the computer, so that we eliminate the error of wrong hearing. So it goes directly into the system what is typed. At that level, we eradicate our medication error. Second example I'll give you. We have an application. In front of every room there's a tab and there's a barcode. When the doctor enters there, he clicks on the barcode. That patient's details, vitals, everything comes on his mobile before he enters the room of the patient. So he knows what time, at that time, what is blood pressure, pulse and vitals. When he enters, he says, oh, your blood pressure is good today. So the patient says, oh my God, this consultant is taking great care. Third is life-saving. One of the examples I'm giving, the life-saving is when there's a code blue, every hospital has the lights blinking on the room. But the difference is the frequency of light blinking in that room where the code blue has happened is different than all the other rooms have the blinking and they give direction. Where is the code blue? So the blinking frequency of different rooms is directing to the place where the code blue has happened, and code blue is life-threatening situation. So that saves the golden time to act, react, and give the proper medication. So this has given an integration to all levels by HL7. All our systems are integrated to the equipments of the hospital, which could be a ventilator, which has integrated system. In a resuscitation area, when the patient is come as cardiac arrest, there is a cartridge which shows the monitor, and when the patient is stabilized, shifted to different, the cartridge is taken and placed in the ICU. That cartridge will show what happened during the stay in the resuscitation in the emergency. So that again, as you previously mentioned, continuity of care. It carries in case of emergency as well. So all these levels integration gives us, and to stamp it, we got the Best IT Innovation Awards from Dubai. That stamps us to give us a great edge over patient care, integration, and outcomes.
Dr. Vineet, where do you see Dr. Sulaiman Al Habib Hospital in the next 5 years?
Next 5 years, as I mentioned in the past, that from doorstep to bedside, we need to have everything integrated to give the best quality care. One, internationally recognized healthcare organization, expansion into not only GCC, going to different areas to give the best expertise, and to invite faculties and super specialty to be integrated to our system. Why we want to do that? The previous situation used to be a patient used to go to a clinic and he has referred to some other place to go to some other place for MRI, CT scan for that matter. Now all services under one umbrella. Now that umbrella we want to integrate into different specialities. For example, a patient comes of a burn patient. Now he would like to be treated there where he has come. So to take care or decrease this condition of the patient or the pain, we need to provide care and services. So adding of services, bringing in more super specialized, more knowledge from outside, and remaining on top in terms of sustaining the journey of our quality care. Now that's the aim. Expansion always leads to more variety of processes, and adding and learning from the improvement processes we want to add to integrate ourselves to be, as she also mentioned and I also agree, human elimination process orientation. That's the target.
Right. And what about you, Dr. Malathi? Where do you see Aster DM Healthcare in the next 5 years?
To put it in a nutshell, I would say we would like to be one of the top advanced integrated healthcare provider. So that's a very complex sentence probably, but putting it up into different baskets, it would all focus on one very, very important aspect, as I loved saying that I would delight my customer. So what are these things that can come into this process? One of the things that we believe would be making sure that every organization of ours has definitely an international accreditation. That's where we started off. So that's what we would aim as, which will be responsible for our sustainability picture. But very important for me also is, as I said, we would want every department to be a center of excellence. And that means putting in systems, putting in standardized pathways. So I know that a patient who comes, who's a cardiac patient entering into my hospital, would definitely go through this same process. So it becomes very standardized. So that is what I call as centers of excellence. A third thing that we would like is, and we believe a lot in, is organizations grow only if there is academics. So a vision for us is that every individual should be very well trained. So what we would like is to set up skill labs, which we are doing even now, but these skill labs are used for our own internal purposes. The nurses get trained, the doctors get trained, whether it is to do procedures like a lumbar puncture, and all of these are given credits by the Dubai Health Authority. And unless we keep training people, giving them refreshers, you wouldn't be able to be very sure that I'm delivering what is right for the patient. So academics and research is something that we would like to focus on. And if you would like to ask me, our theme is basically in our vision. We align everything that we do to the vision of Aster DM, and that is caring mission with a global vision. That's our what we talk about our vision. So it's very, very clear that it talks about caring of the people. And the caring we believe now is we have to look at moving. Of course, therapy is very, very important, but it is time that we looked at hospitals more importantly for preventive strategies rather than therapeutic. Therapeutic is important. We are working towards it. Clinical excellence is a part and parcel of it. Academic excellence to complement it. But we must culminate it preventive. Does a patient or an individual need to fall sick? What is it that I can do to prevent him from falling sick itself? We might think that would bring about a loss in the revenue to the hospital, but it defeats the purpose. Healthcare industries should move into what we call as preventive health strategies. At Aster DM, it is our endeavor that it will be in the next years to come to see how can we be preventive health strategy experts. That means we try to find out, I call it as predictive analysis. Patient walking in for my health check, I should be able to predict that this person could go in for this particular problem. What can I do in advance? So we are looking at artificial intelligence in a big way. We have set up an innovation cell now, which will be coming up very shortly. It would have the best of the people, very, very young minds, because we believe in out-of-the-box thinking. Otherwise, you are like horses blinded on either side, and we believe this is the way to do things. They may come out with things which are ideas which we believe are going to be creative, out of the box, sound ridiculous and crazy. But it doesn't matter, because I'm sure in that will be the element which will give us what we aspire to do, and that is prevention. As we always have said, year-long prevention is better than cure. And I think in the next years to come, our focus is going to be totally preventive health strategies. And that's what we would like to achieve.
Thank you. You have been very, very descriptive. And I would like to add a few things. When we talk of future, future always depends on the past, present. Now, what has been a healthcare in the past? Brick and mortar, building, patient comes in, gets the treatment, goes out. What has become present? Engagement with the family. Now, what could be the future? We plan in Sulaiman Habib to have a future MDT, as they say, multidisciplinary team, which means that at one moment a patient is looked into different specialities if you have different type of symptoms. So the care is given instantly one. In case the patient or the doctor goes outside country, we have a system of direct video chatting with the doctor and the patient. Additional example is that when, for example, a mother is delivered, she wants to see her child. We have a system in the bassinet. Each bassinet has a camera above it. The mother on 6th floor can see her child at 2nd floor. Now, this was not because Dr. Habib wanted to separate them. This is a long vision which says prevention of infection. Now, if you start handling a newborn child by relatives which come and try to cajole, that creates a possibility of infection. So we give technology an edge to prepare and prevent the case. He said, very well said, prevention is better than cure. Now, this is one of the examples of prevention. So that gives us an edge to plan for future and to say that yes, we are going in the right direction. So that's how a futuristic approach we normally tend to take.